Welcome back. I'm Dr. Ahmed Kazmi, and something I've noticed is that people often use the terms cold, flu, and chest infection interchangeably. And whilst it's true that there is a little bit of overlap in their symptoms, on the whole, they're quite distinct problems. And I'm hoping that by watching this video, it will all be a bit clearer to you. Let's start with the common cold, which is, just as the name suggests, the most likely reason why you're coughing. During the winter months, viruses can sometimes infect our upper airways, and this causes the all too familiar symptoms of a blocked or runny nose, cough, sore throat, and ear pain. The coughing from a cold can be really troublesome and can often linger for several weeks. Spitting up phlegm can lead a lot of people to believe that this is coming up from their chest. But actually what's usually happening is that the sputum produced from the mouth is actually coming down from the nose rather than up from the lungs. This is called postnasal drip. And it's also found, interestingly, in hay fever. The cough from postnasal drip is often worse when lying flat and worse first thing in the morning. There are a few ways to help differentiate the cough from postnasal drip from that of a chest infection, or pneumonia as it's also called. The first one is the presence of upper airway symptoms. So a pneumonia or chest infection wouldn't usually give you a blocked or runny nose, sore throat, or ear pain. The other one is how unwell the patient is. A chest infection usually makes the person very unwell. They have a high fever, they may have difficulty breathing and pain on breathing, and these signs usually aren't there in somebody who just has a cold. It's also worth remembering that chest infections are pretty rare in fit adults, and they tend to occur in the elderly and people who already have a breathing disease, such as asthma or emphysema. Now onto the flu. The flu has three main symptoms: a high fever, significant body pains, and a runny nose. The symptoms tend to come on quite suddenly, and it usually clears quite quickly also, and it tends to occur on a seasonal basis at particular times of the year. If you suspect you have a chest infection, you need to see a doctor, as these require assessment and treatment. Colds and flus, on the other hand, almost always get better by themselves, and you would only really need to see the doctor about them if, for example, you were pregnant, elderly, had serious health problems, any breathing problems like asthma or emphysema, or there was something about your symptoms that was particularly worrying you. And I'm afraid it is true, coughs, colds, and chest infections are all more common and more severe in people who smoke. So I think that's another good reason to consider quitting. I hope this tutorial has helped clear up for you the difference between the flu, the cold, and chest infections. And remember, guys, every time you refer to your cold as a chest infection, somewhere a little fairy dies.